Hello guys, welcome to IGCSE PE. Today we're going to do movements of the joints. So the first movement we're going to do is circumduction. Circumduction is a circular movement of around the joint axis, and this takes place at the ball and socket joint of the shoulder. It is also circumduction of the hip, so circular movement of the hip. Then we have pronation, inward rotation of the palms. Then we have supination, is outward rotation of the palms. Then we have abduction. Abduction is movement away from the body. You are getting abducted, so movement away from the body. Then we have adduction. Adduction is movement towards the body. Then we have flexion, which takes place at the hip joint, and also at the knee, and also at the elbow, so flexion. Then we have extension, straightening of the limb. So flexion of the hip, extension of the hip. Then we have hyperextension, movement beyond the plane. Then we have flexion, bending of the hip. Then we have plantar flexion, which is we're planting the feet towards the ceiling. And then we have dorsiflexion, where we on the balls of our feet and we're lifting towards the ceiling. And that is it for movements of the joint.
In closing, some of the other movements of the joint includes flexion and extension of the knee or the elbow or the wrist. Then there is medial and lateral rotation of the shoulder. So lateral rotation is the outside rotation of the shoulder. Medial rotation is the inward rotation of the shoulder. Then the third movement is elevation and depression. So it's lifting up the shoulders and pushing them down. Elevation for lifting them up, depression for moving them down. Then there is abduction and adduction, as I've explained. Abduction is movement of the hip joint away from the body, or movement of the shoulder girdle away from the body. And then adduction is movement of the shoulder towards the body and movement of the hip towards the body. Then we have circumduction. Circumduction, it takes place on the sagittal or frontal plane. It's the circular movement of the shoulder or the hip. And then we have pronation and supination of the elbow. Supination is the outward rotation of the elbow, and then pronation is the inward rotation of the elbow. And then we have dorsiflexion and plantar flexion, and that takes place at the ankle joint. So dorsiflexion is movement of the ankle towards the leg, and plantar flexion is movement of the joints towards the sky. And then we have eversion and inversion, and that takes place on the frontal plane.